Okay, awesome. So, hi everyone, and welcome to today's virtual Hinckley Forum. My name is Tammy Reque. I am an economics ambassador, and I will be serving as the moderator for today's conversation. The Hinckley Institute of Politics is a nonpartisan institute at the University of Utah. The Hinckley provides an array of transformative experiences for students through internships, forums, and classes. Hinckley forums seek to foster public discourse and civil debate on the most current and pressing issues, bringing in local, national, and international thought leaders. So today's forum is presented in partnership with the Economics Department and Economics Ambassadors. So if you are a declared econ major, actually, applications are now open to become an econ ambassador for next year. I highly recommend. It's a really fun group to be a part of. So if you are interested, applications are due on April 25th, and all you need to do is email your resume, a personal statement, and the name of an econ faculty who has agreed to support your application. And you just email all that to advising@economics.utah.edu. We would also like to thank our media sponsor, KCPW, for recording and rebroadcasting our forum as a part of the Hinckley Radio Hour. So today's forum is the politics and economics of COVID relief and economic stimulus policy. We are joined by panelists Phillip Singer, Assistant Professor, Political Science at the University of Utah, Rudy von Arnim, Associate Professor, Economics at the University of Utah, and Juliette Tennert, Chief Economist at the Gardner Policy Institute. So we thank them for being here today with us. If you have any questions, you can enter them in the YouTube chat, and we will get started now. So this first question is to all of our panelists. So most know that they might get some cash for COVID relief and the stimulus checks, but are not as sure about all that entails. So first off, what would be your 30-second elevator pitch describing the fiscal packages during the pandemic? And are they a unique response to this recession, or have they been used in the past? Can we start with Rudy?
For sure. Hi, yes, my name is Rudy von Arnim, as Tammy has introduced all of us, and I'm grateful for the ambassadors and Hinckley to allow for this conversation. So the COVID relief bill, there have been several already, but the most recent one that's by now has been passed is labeled the ARA but is popularly known as the COVID relief bill, and encompasses about $1.9 trillion. And the first question here is this 30-second elevator pitch, and so let me try to do that. The key pieces of this legislation are very standard stimulus measures that support extended unemployment benefits, and other such measures that support the economy in a severe downturn. And in this sense, the bill is really business as usual. It is different because it includes this direct payment to a large number of US households who receive up to $1,400 in cash, or have received by now up to $1,400 in cash. And that is somewhat unusual. The second element that is unusual is support for childcare, in particular the child tax credit, which is sizable. And that is also not usually part of a stimulus bill, but it obviously makes eminent sense in the current situation. And it is, however, both of these pieces, which are unusual in regular stimulus measures, are temporary, and in that sense also a quite normal stimulus activity because it pertains to the short run. So they will expire unless they are made permanent or are extended, which would be just before the midterm, which then would get us to the type of political discussions that are associated with that.
So I'll kind of jump on Rudy's comment there. So I think it's interesting, especially when we compare kind of the COVID relief bills to kind of the relief bills that were passed or enacted in, I think, 2008 and 2009. So, and just to pick on the kind of the unusualness of the direct payment, right? So in 2008, George W. Bush signed a stimulus act into law. And if I recall correctly, it was about $1,200 per married couple, $600 for individual taxpayers, with a $300 per dependent child. And then in Obama's stimulus package, so he, passed in 2009 a stimulus package that kind of totaled like $14 billion. And instead, there was a tax withholding, a tax credit. And it would have paid kind of individuals $400 per individual or $800 per couple. And so it's interesting, and so I'm not an economist. I don't purport to be an economist, so I will defer to my colleagues here for their expertise on this. But it does raise this like really interesting kind of political dilemma and political element, right? So this is where kind of I think the politics of credit claiming really comes in nicely, right? So even though Obama, put money into people's hands and actually faster than the George W. Bush checks, a lot of people didn't realize that they actually even received money because it was in the form of a tax cut, right? So going back to the first $1,400 or $700, whatever it was, with Trump, I mean, it was signed by President Trump. I think I got a letter from the IRS. Like, so it was this really interesting, like the politics of this, I think are really interesting. And, maybe we'll talk about that at a later point, but I think it's important to recognize the way in which kind of our politics have shaped kind of the economic plans as well. And so independent of everything that's in there, I think kind of the politics are really important in understanding and kind of the ways in which our economic recoveries have or haven't occurred. And so that's more than a 30-second elevator pitch. So I made a 1-word elevator pitch, and that was necessary. Like I feel like as a non-economist, but as somebody who is at least aware of what's going on in the economy, the word that I would use to describe it is necessary.
All right, well, I'll just jump in now, and I feel like I can just say ditto to everything that Rudy and Phillip said, and I would definitely agree with characterizing the stimulus in 1 word in an elevator pitch as necessary. I am an economist, and I do think there's probably a problem. We've got 2 economists on the line. If we get any less than 3 opinions, we're probably not doing something right. So it will be interesting to hear what Rudy has to say on that. But I would definitely characterize it as necessary. Just adding kind of to the highlights, fiscal stimulus in response to the COVID-19 pandemic recession has been incredibly large. We've seen 5 major pieces of legislation pushing federal funds into the economy, totaling almost $6 trillion, kind of depending on how you do the math, but near $6 trillion, which is between 25 and 30% of gross domestic product. So the response has been, I think, necessary and really in line with especially the situation in the spring, right? Really, the world economy fell off a cliff, and there was tremendous uncertainty. There's normal business cycles, and there's recessions and fiscal shocks, but really we had a global pandemic where policymakers didn't really know what the next 3 months were going to look like, what the next 6 months were going to look like. And so I would argue that the size of this federal fiscal stimulus has been appropriate and large. We've talked a lot about kind of the income that is pushing into US households. All in all, between tax credits, direct payments, unemployment insurance benefits, the PayPet Check Protection Program, about 2/3 of that, almost $6 trillion, has really gone to support income in households. And the remaining amount has been in the form of support to state and local governments, healthcare services support, infrastructure support, but really a large portion of this funding has gone to support household income. I mean, again, unique and not unique. It is normal to see the federal government step in times of economic distress. We definitely see some form of fiscal stimulus in response to every major recession. What's unique about this, in my opinion, really is the size. And again, that's unique, but again, not surprising given the situation that occurred last spring, and is just, we're just kind of probably seeing the light at the end of the tunnel.
Okay, I'll jump in quickly. That's really I can also only agree with Philip and Juliette, and I also want to add that it was absolutely necessary, right? So there's like this, and I probably didn't emphasize that enough, but it's necessary, and in this sense, this sheer size of the overall packages that Juliette is emphasizing is sort of makes it a very unique thing also, right? So the COVID support, the fiscal support due to the COVID pandemic and the lockdowns across the country are unique due to their sheer size. And otherwise, that the unique feature is that direct cash payment. But I'm also really glad that Philip emphasized this comparison to the Obama programs, to which I want to add this small point, that Obama and his advisors were influenced by particular ideas within economics, where the thought was that we got to sneak this money into people's pockets, because if they don't realize that they're getting it, then they're more likely to spend it. And so it was by design that they didn't get any credit for it, and sort of that might have meant that a bigger portion of it was spent, but it also meant that they certainly didn't get any credit for it, and that has changed significantly with Trump putting his signature on the checks, and now the new administration saying here's your cash, period, and so the dynamics of that are very different. It's still not clear whether a big chunk of it is going to be spent, but in the income brackets where it's being handed out, it is likely that it's going to be spent.
Well, and I think it's also interesting, sorry to jump in here, but I think it's interesting, like lessons learned from, particularly from the Obama administration kind of efforts, right? And when thinking about particular advisors in the Treasury Department or in the Council of Economic Advisors in 2009, and some of them even recently have been talking about raising concerns about overheating the economy. And that's not for me, and I'll defer to my colleagues to kind of respond to that. But it's interesting where there's my view on this is, at least politically, 2009 was too small. And we're seeing kind of a lingering or slow growth, economic growth and employment growth. And we see kind of the politics and how that shaped the rest of the next 8 years of kind of the Obama administration. And I think the benefit here, at least for Biden, was he had kind of the frontline view of the problems of going too small versus too big, because the size and scope of this really is just, as my colleagues pointed out, like so much bigger, which I think is really interesting, and it'll be interesting to see, as Biden has talked about infrastructure and other spending bills, there's been less of a concern of going too big, at least so far in the administration.
Thank you. And that's a perfect segue because we know that a lot of people are concerned with such massive fiscal stimulus. So, Rudy, do you think we should be concerned about increases to debt or inflation arising from these policies? Or what would happen if most of this money goes into savings instead of circulation?
Okay, thank you. That's a very good question. It's of course the question that's on everybody's mind concerning these packages that are now being discussed. So to try to answer this, let me sort of step back just a little bit and emphasize two different issues. And the first is the science of stimulus, and the second is the size of stimulus. The size of stimulus we sort of already touched upon a little bit, and there's this issue that with COVID, everything is different. And so the size of these packages we have to look at in a different light. But we can certainly assess the size of the currently discussed infrastructure build-in. But the first issue is the science of stimulus. And the science of stimulus is really quite clear at this point, namely that the global financial crisis of 2008, 2009 pushed us to what we call the zero lower bound, or what used to be called a liquidity trap. And that is a situation where interest rates are at zero, and this sort of very expansionary monetary policy is unable to generate sufficient increases in demand and employment to get you to a situation of normal. And the key issue here is that in that situation, monetary policy simply is not any longer effective, which is why the Federal Reserve is conducting these unconventional measures to buy assets at the long end of the yield curve, and it obviously has done that since 2008, but has, and then, there was a time around 17, 18 when there was some attempt to normalize monetary policy, but that was probably premature, and then COVID upended all of it. So we are, the point is, and as Phillip really has alluded to already, 12 years after the big shock with the collapse of the financial system, we are still at the zero lower bound. And even though we've achieved these 3% unemployment rates pre-COVID, we are not in a situation of economic health and sustainability where such employment rates are leading actually to income growth for the vast majority of people that are engaging in the labor market. And so the bottom line is that the risk of overshooting in terms of stimulus, both monetary and fiscal, is very, very small, whereas the risk of undershooting and being excessively cautious are really, really sizable. And this is, I can drone on about this forever probably, but the thing that I want to emphasize is that this is not a liberal opinion. It is the science of stimulus. And there's a very strong consensus on these matters that how this works. So the only question that is being debated in market economics and concerning monetary policy and fiscal policy at the current situation that the U.S. economy is in, the only thing that's being debated is whether these expansionary effects from these stimulus measures will lead to only a temporary or a permanent increase in inflation. And some of the more cautious macroeconomists think that there's some risk that these effects might be permanent. But I would say that the vast majority of economists think that they will be temporary. And so again, that debate can be summarized that the stimulus is necessary, sizable stimulus is necessary, and it is very likely to have only temporary effects on inflation and debt. And then the risk of overshooting is vastly smaller than the risk of undershooting. And that's sort of the bottom line of it. How big these risks of undershooting are is, I want to just emphasize this. There's an economics reporter in the New York Times yesterday had a piece. Neil Irwin is his name, and he is sort of probably a slightly dovish reporter, but even Neil Irwin makes the mistake of suggesting that a current 12-month increase of 2.6% in the inflation rate is an uncomfortably high rate of inflation. And that is simply wrong. That's not just like an interpretation that can be debated. It is simply and factually wrong. And if people in the center of these political debates make such mistakes, this illustrates how dramatic the bias towards undershooting in terms of the size of stimulus, both monetary and fiscal, the tendency is. And so that deserves sort of all of our attention. And it is really, kudos to Jerome Powell that he's kept the Fed in line of not making mistakes here. So I think I'm going to pause here, but I'm happy to, I would be happy to discuss the infrastructure bill a little bit more, because the infrastructure bill then really is, again, a different animal, because it's not about this short run stimulus to get us out of the recession, but it's about, trying to sustain growth in the long run. And that sort of deserves also further thought.
Thank you, Rudy. That was very insightful. And again, the size of the bills, I guess, is what been concerning people the most, and what caused a lot of division in the Congress to pass these bills. So turning the time a little bit to Philip, do you think that what was passed is sufficient and effective enough, or do you think we're missing out on something that could be better for the situation because of the political polarization and how hard it was to get people on the same page?
Yeah, so I think that's a really great question. If we're looking at over the last, 75 years of kind of political science, I think one of the big stories that we're going to want to tell ourselves is about political polarization, both amongst kind of elites in Congress and us as the public, right? And I have a more optimistic take that I force myself to think about, because I am generally fairly cynical about this. What kind of effect COVID will have on polarization. But it's interesting when you chart out kind of all of the different spending bills, the three during the Trump administration in 2020, and then the most recent recovery plan under the Biden administration. And it's interesting, particularly when you're looking at the Trump administration time period, the length of time and the amount of disagreement increases over time, right? And so there's some like political low-hanging fruit where there's at least some agreement. We need to get kind of, we need to increase appropriations to, federal agencies, to state and locals, to, get money into people's pockets. And then, you see, it was Mitch McConnell after the last Trump era spending bill, said, he kind of uniformly was opposing more spending for states or local governments, right? And I think Juliette had mentioned like the elements that were focused on state and local governments. And, he had said, that if states or local governments need more money, then they can go down the bankruptcy route, which is a direct quote from him, from the then Senate Majority Leader McConnell, right? So you see these kind of divisions emerging where I think my concern is, did we underfund state and local governments, particularly in 2020 when so much of the onus on responding and containing kind of COVID was placed on the states. And, looking at this interesting tension that, governors and mayors have on, if you don't have the financial support, then the pressure is going to be to open up too early, right? Even independent of like whether you're a Republican or a Democrat, the pressure for tax bases and businesses and everything else is to kind of be, quote, open for business too early. And so without kind of that federal support, and when you have, again, at the time he was Senate Majority Leader, the most important person in one of the chambers saying that state and local governments should go down the bankruptcy route, I think that signals where political divisions were occurring, particularly later on in the fall of 2020. I think it's also, I'm going to highlight something. So some work that I have. So I have a book where I wrote a chapter in the US response to COVID-19, and it's part of a larger kind of book that I believe will be published next week through the University of Michigan Press. And in it, we're comparing basically across 34 or 35 different countries and how countries across 6 continents responded to COVID. And it's just impossible to kind of divorce how weak and or frayed the social safety net in the United States is compared to other OECD countries or other countries around the globe. That makes it difficult for us as policymakers to go from 0 to 60 as quickly as some of other countries where they had kind of systems, programs, policy already in place. And it was interesting reading other contributions to this book. There was a lot of, in Denmark, a lot of building on already existing programs. And so the US, our social safety net is frayed, it's weak. And because of that, it makes it harder to do, I think, a good job when an emergency like COVID occurs. And as well as, we've kind of chronically underinvested in our social safety, our social policy prior to this point. And any kind of social policies that we do have are so fragmented that it makes it really difficult. So I think, there's the, what is it? Good being the enemy of, perfect being the enemy of good or whatever, right? Congress did need to respond quickly, but I think it's impossible to divorce kind of what we have done with policies that were in place beforehand, as well as kind of the politics and the political polarization that did kind of place some, I think, limits on how and where the funding was spent.
Thank you. And thank you for bringing up about the states and how that was organized as well. Because we saw that besides the stimulus directly to people, some of those benefits did come by the way of grants to the states. So Juliette, could you give us an idea of what that looked like for Utah, and where do you think those grants has been the most beneficial?
Sure. Thank you, Tammy. And thank you, Philip, for really setting that up quite nicely. So all in all, when, we've kind of added up as best we can, all of the different funding that's come into the state of Utah through these federal fiscal stimulus pieces of legislation, we estimate that around 22 billion is the total number of spending taking place in the state of Utah. And so to put that into perspective for you, that's about 12% of our state GDP. So definitely not an insignificant amount relative to the whole economy of Utah. And also, I'm a former state budget director, so my lens is always kind of through the state budget. That $22 billion that's coming to this, that has come and is coming into the state, is equivalent to the entire state budget, all state spending for a year. So it is not an insignificant amount. Like kind of the distribution of the overall for the United States, the distribution of like the types of spending in Utah is really similar. So around 2/3 of that total is going to some sort of income support in our state, whether it be through the unemployment insurance benefit program, those direct payments to Utah families, that paycheck protection program. So about 2/3 in this household income support category. I should mention that $22 billion that we've calculated does not include the value of the child tax credit extension or enhancements. And so that's something for some initial work. I do think that that will have some beneficial impacts in the Utah economy, given that on average, we have more children in our economy. I think that that will be beneficial. So those numbers don't include that. About a quarter of the spending in Utah has been on these state and local grant programs. And I would agree with Phillip, and again, through this kind of former state budget director lens, that the initial funding that was provided to state and local governments was, I would say, too lean. As Phillip mentions, that this is all happening so quickly, and state and local governments were on the front line of response. And so I would have liked to have seen, well, the getting money into households is important, and I think that the amounts have been large and necessary. I would have liked to have seen in those initial rounds more support for state and local governments. And Utah was kind of in a position where we had really sizable rainy day funds. Our economy was at a really good place coming into the recession. And so, the state government, at least in Utah, and some local governments were able to respond even without that additional support. But from kind of even the Utah perspective, from my Utah perspective, yeah, we were prepared and able to handle it. But it's kind of like if your neighbor's house is on fire and you've done everything you can to prepare your house, and so you're sitting pretty good in terms of preparation. You can't just sit there and say, well, my neighbor didn't prepare for this, I'm just gonna let that house burn, because it can it can trickle over to your house, right? And so same thing, even for those state governments that were relatively prepared coming into this thing, when you're talking about, additional stress for the California state budget, for the New Jersey state budget, for the Illinois state budget, our neighbor Nevada's budget, even from a Utah perspective, I would have liked to have seen more state and local government support. Now, with the most recent round, the most recent Biden fiscal stimulus, we do see that additional state and local government funding in that, actually more than twice what was initially provided last spring. And so that will be helpful. Like I said, about a quarter of the total that's coming into the state of Utah, but that money has been spent and will be spent on economic development, on supporting businesses, supporting labor, has been spent and will be spent on different supporting essential workers, healthcare. So it's been, if you kind of are getting the flavor of what this stuff is, it has been incredibly helpful, and I feel good about the most recent round having a fairly sizable amount of funding for state and local governments.
Thank you. Thank you for bringing that perspective from our state and local governments. So we'll do one more question for all panelists, and then we'll move on to our audience questions. So again, if you have anything you want to ask, you can type into the chat on YouTube. But based on the previous recessions and current economic forecasts and how we were discussing, it might take us a little while to recover economically from COVID. So in your point of view, what do you think are the most important policies that need to be implemented and that will help shape a prosperous future?
I'm happy to
go ahead, Rudy.
Okay. I'm happy to go first on this because that allows me to go back to the infrastructure plan, and then I'm curious what Juliette thinks about that. I think that let's make an assumption. So let's assume that the vaccines are going to work and we're not going to get a very dangerous variant that undermines the vaccination effort, and so that we're going to really, towards the late summer and the fall, we're going to be in a situation where the economy can function a lot more normally than it has over the last 15 months or 12 months. And that also the COVID relief bill just passed is going to be an effective short-run stimulus. And so that we're going to resume sort of normal activity, which then is the question Tammy asked, what do we need to do in order to sort of sustain that recovery? And that's where the infrastructure plan comes into play. There is a couple of things to say. The first is that infrastructure in the US is crumbling. With the famous stories of bridges collapsing literally repeatedly in various places over the years and across the country. And then the disaster in Flint, Michigan, all kinds of issues that are related to the very basic infrastructure of our daily lives, both economic and otherwise. And we've known for a couple of decades at least that huge investments need to be undertaken in order to fix these things. And now we have a proposal that seeks to do that. So let's do it. There's nothing else to say than this is the basis for lots of the things that happen in our lives, economic and otherwise, and it's the foundation for a lot of things to function in a reasonable manner, and so it needs to be done. The other question is then in the infrastructure bill, is sort of the redirection of the energy grid and measures in the infrastructure bill that are not typically associated with infrastructure, particularly in this case, the care economy. And I would just submit that we need to respond to the climate crisis, and so that expenditure is necessary and probably too little and will need to be followed up with more. And we also need to address this fundamental weakness of our social safety system that Phillip has mentioned, and the care economy is a big piece of that. Need to make that child tax credit expansion permanent and address elderly care issues also. So all of that is in the right direction and probably needs to be doubled down on. And these things, all of these things in combination is what can really sustain the recovery into a sort of return to normal growth that is also sustainable in light of climate change. And so in that sense, it's a step, probably still too small, but it's a step in the right direction.
I completely agree with everything that Rudy has to say. In terms of policy, response, the most beneficial are those that are kind of like the 2-for-1s, right? So there are those policies that are pushing cash into the economy right now, but then that we also get some long-term payoff for economic stability. And so infrastructure is a perfect example of that. And it's something that I do think that we need to invest more on, also with an eye towards what, what our future looks like in terms of energy and climate change. And we just have a really great opportunity to start addressing or continue addressing some of those things, hopefully on an even larger level at this point, where we get a payoff in the immediate term, as a response to recession, and then build out long-term economic stability. Something to kind of keep in mind here, we talk about the care economy, and I do think of, care as infrastructure. I really think it's an important piece of the conversation here. A lot of economists have been talking about this K-shaped recovery, right? So as the recovery starts to take hold, economic growth starts to take hold, and we have, this upside of a graph, so kind of the upper leg of the K, and we're seeing that. I mean, we've seen a lot of American citizens are in a privileged situation where they were able to work from home. Stock market is doing great. Recovery is fully underway for many sectors of the economy, and in some cases was not that much of an impact for many people in the economy, and that's that upper leg of the K. Well, that lower leg of the K is what I'm most concerned about, and so those are our vulnerable populations. Caretakers who had to leave the workforce. Many women are in those categories of population. Rural economies. So they're in this position where they've had this impact of the pandemic recession, and we're really not well situated to begin with. If anything, I think that this pandemic has really highlighted some of the vulnerabilities in the U.S. economy and the worldwide economy, really. And so, for me, the best policies will think about that K leg moving forward. Providing childcare to get people back to work. Figuring out how to provide supports in terms of education and training for people who have been impacted by the pandemic and disproportionately impacted by the pandemic to have job opportunities. And of course, as Rudy said, I think that infrastructure is a really important piece of all of this.
So my background is actually in kind of healthcare, health policy, and health services. And so, I think of the types of policies that I would like to see kind of really through that healthcare lens. And Juliette's kind of K-shaped recovery was actually the note that, in less eloquent terms, was the note that I had kind of written down to this, to Tammy's question here. And I remember seeing something along the lines of a sentiment something along the lines of, diseases are the great equalizer, right? So we're all banding together in, response to COVID-19, and that is absolutely not the case. So we need to make sure that from a health policy perspective, because that's what I can speak kind of most in my wheelhouse here, that we are creating policies where we are kind of not leaving people behind, right? So over the last 15 months, we have seen disparities in outcomes, disparities in care, disparities in utilization, disparities in economic hardship that have always existed, but they've only become more pronounced or more easily identifiable over this last 15 months of time. So I think, and this is, I alluded to kind of the tension with me between like being cynical or optimistic, right? So I can think of kind of a group of Americans who lived through a transformational epidemic 40 years ago, through through the HIV/AIDS epidemic, and it's different in a lot of ways from coronavirus. But I think there's one kind of key lesson, and that is plagues can drive change. Partly because the U.S. government failed in response to HIV and AIDS. Homosexual Americans had to mobilize. They had to build organizations. They had to build networks and know-how that changed society, and I think has enduring legacies to today. So, I think, HIV/AIDS uncovered the need for the protection of marriage, and exposed deadly flaws in our healthcare systems. And so change is that we've seen over the last 40 years in response to that, I think, that gives me at least some hope that we can take this awful experience and be able to go forward a step in the right direction. I think even something as little as kind of renewed emphasis on telehealth medicine from a healthcare focus, where we can change the paradigm of where healthcare delivery takes place. I mean, literally just before this, our forum started, my wife and I were on a telehealth visit with a neurologist, right? And it's incredible that this is now like the new normal. And so if we can align our payers, our providers, and our public together, and there's lots of instances like that, even in the healthcare field, not even in economic policy or housing policy or environmental policy. I think there's really great opportunities, but I think there is this sentiment that with these pandemics, change is possible. And so I think it really does offer a really great opportunity going forward.
Great, thank you. And actually, one of the audience questions relates to that. So someone asked that some responses to past crises created permanent programs, such as unemployment insurance, agricultural price supports. So do you think there's some aspect of the current response that will or should be permanent?
I'm going to jump in here, but because I think Juliette's point, and I want her to speak more about this, but I think the care component of this is incredibly important. And I have a paper under review currently where we're looking at kind of caregiving, health caregiving, and it is just such a mishmash of public programs that don't offer very robust coverage. And, so much of, even before COVID, so much of our kind of long-term care giving was, not being family members and just the stress. And
I think we lost Phil, so maybe I can just, there he's back.
sorry, this is normally it's a much more frequent that I get your internet connection is unstable. There's a reason my classes this semester have been asynchronous, so I apologize. I think though it's kind of, there's been a very important recognition of some sort of universal family care, right? And so much of at least healthcare giving has been devolved to the states, which means Utah is different than Nevada and Idaho and California. And so your geography really influences your ability to have Medicaid pay for long-term care, or have, Medicaid pay for, child care and things like that, that I think it's been such a nice kind of focus on this overlooked area of how we can provide kind of universal family care in a more robust and systematic way.
Yeah, I'll just add to that. I mean, again, it's not, the importance of that care infrastructure, this is not a new thing, of course, but what's happened with the pandemic and the recession and the populations that have been hit it's really, that importance has really been highlighted. And I think that even the most privileged amongst us have recognized how important having that kind of safety net infrastructure is, and policymakers are recognizing that as well. And so I think that that's something that I would like to see passed at a greater level and more permanent into the future. And I think that's something that can support economic stability. The other thing that I'm not sure, like I think climate change came up, and my my hope is that, I mean, so there's like the kind of public policy sphere, and then there's also like the kind of economic business policy side to this, where we've seen this acceleration in, you know, the use of technology and people being able to work from home, and hopefully, you know, setting up a path for not consuming energy in the ways that we've been consuming it. And so I would just like to, I would like to see kind of that acceleration and kind of that motivation to address some of these energy issues stick. And I think that it really needs to.
Okay, let me just say one sentence to tack on to both of these comments. The thing that the pandemic really changed, to my mind, is that the default opinion that government is always the problem is gone. Right? The pandemic really clarifies you can't solve the pandemic with market solutions. And the government is the only solution to the pandemic. The government needs to run the lockdowns. The government needs to stopgap incomes, and so on and so on. The government needs to finance the vaccine development and then the distribution of the vaccine. Everything is public. So that's the thing that sticks. This is always the case, but the pandemic has highlighted that this linkage exists. And so it opens the door to these conversations about climate and health. And I think that childcare, elderly care, healthcare in general, and addressing the climate issues, and also building some bridges, these are exactly the pieces that we need to talk about.
Thank you. Another question from the audience is, what did this last year teach us about the national debt? As the US debt passed the GDP this last year, we passed a marker economists thought might trigger an economic crisis. So Rudy, do you want to tackle that one?
Yeah, thank you, Tammy. That's a great question, and I want to go back to the debates about the Obama stimulus and the ramp up of the debt about in the wake of the global financial crisis, because around that time, there's a famous book that came out by Reinhardt and Rogoff, prominent economists, who suggested that there was this threshold at roughly 90% when the national debt, right? So for everybody, the debt is a stock. So it's like the water in your bathtub, and you turn on the faucet and that adds a flow. So the deficit, the annual borrowing of the government, is the flow that comes out of the faucet, and then in the bathtub is the stock, right? So that's the difference between the deficit and the debt. But if the debt reaches 90% of GDP, Reinhardt and Rogoff said, you'd have really adverse consequences for economic growth. Famously, it turned out that result was entirely dependent on a typo in the Excel sheet that this calculation relied on. So a graduate student back then scoured through all of the calculations and found the typo, and the result disappeared. The bottom line is that there is no known threshold where adverse effects arise. The only thing that matters is whether you have a solid foundation in your economy, whether you have a stable currency, and whether you have some independence in, on the world stage. So, all of these characteristics apply to the US. So the debt is not an issue in the US, as, of course, Dick Cheney famously said, deficits don't matter. When Republicans are in government, they always say deficits don't matter. No, this does not matter right now. It could potentially, if interest rates really increase very strongly, but there's no reason to assume that they would anytime. So I'll leave it at that.
I can maybe add a little bit to this. I mean, my background, so Rudy's, he does a much better job of articulating this. I'm more of a micro economist and kind of focus on labor in the households. But, I mean, I have this background as in, working in state budget offices. I'm training in, relatively conservative University of Chicago. And so I mean, there is kind of a sense of, we should care about spending, and we should care about a balanced budget. as Rudy makes the point that, there's not some, empirical threshold at which we have a real problem. But, one can imagine that at some point there's a crowding out of investment. It's a borrowing's harder. At some point, you can see that it becomes challenging. I mean, I'm concerned from the kind of standpoint of how large does the debt grow, the point of if there is some, catastrophic economic event in the future, will the federal government be in a position to push in the federal fiscal stimulus that it has? Now, I was making this argument after the Great Recession, and the point is, look what's happened. The federal government was able to respond, at a much larger level to the pandemic recession. And so, take that for what it's worth. These are all kind of theoretical types of arguments. I do think the one thing, though, to kind of keep a handle on is, and even this is even coming from kind of a relatively kind of conservative training, it's appropriate to increase debt in times of economic stress. It's absolutely, from an economic standpoint, it's absolutely appropriate to run deficits during a time of economic stress. Now, the flip side of that, however, is during a time of economic expansion, we should be working away at that debt and working towards balanced budgets. And again, this is all there's no kind of empirical threshold, but, I can understand why policymakers would be concerned about it, but I do think we need to be careful about how we talk about it, because I don't want to discourage the policy intervention during the time of a recession. It's absolutely appropriate, in my opinion, and most economists' opinions, to increase debt during times of recession.
Thank you. So I think we have time for one more question. So talking about wages, the lagging increase in real wages is hard to overcome. Is there a chance of a vigorous improvement in wage earner income? This might help to achieve healthy inflation around 2%.
I can take that question and lead in briefly. It's a tough one because we've seen these 3% unemployment rates pre-COVID, and there was no real increases in real wages. There were some increases in real wages, and that was great to see, but it was, in historical context, the recovery of the new economy crash. So the boom leading up to the global financial crisis, and then the boom, quote unquote, leading up to the COVID crisis, both of these recoveries were extremely tepid in terms of low unemployment rates creating strong wage growth. And fixing that is probably a long-term project. It's not immediately clear whether there are any quick fixes, even though I just have to say that that is the reason why inflation is so low. So, sort of to complete the circle, we don't have to worry about inflation. There's kind of a paradox. We don't have to worry about inflation because workers and employees have no ability to bargain for real, income increases. And so we can push hard on the stimulus front because it's not going to require a strong contractionary response from the Federal Reserve. Now, we sort of want that to change. And so if that inflation arises, then we might have to respond, but that's a discussion to have then.
Perfect. Thank you so much. I just want to thank you all for being here today and letting us pick your brains and helping us figure out what's happening in our world right now and answering these questions. And I also want to thank everyone in the audience for participating in this forum. And I believe there will be one more this year, so just be on the lookout for that to participate in these great events. So thank you, everyone.
Thank you.